Hello, and welcome to the COVID-19 HMIS training. My name is Lindsay LaGrange, and I am THN's training coordinator. This training is only going to be about 5% related to HMIS, and the rest of this time will be devoted to supporting and informing you as a homeless service provider about HUD and the CDC's guidance related to COVID-19. Many of you are on the front lines of this pandemic, and it is paramount that you are armed with the correct information to get us through this safely. So here's today's agenda. We're going to briefly talk about what COVID-19 is, although if you've been watching the news, I'm sure you're fully aware. We won't spend too much time on that. Then we'll talk about some prevention tactics, as well as the CDC, which is the Center for Disease Control, and HUD's guidance for homeless service providers. We're going to talk about some planning and treatment options, as well as staff, facility, and client considerations. I'm going to throw a lot of resources your way to help you as much as we can. So let's talk about COVID-19. COVID-19 is a respiratory disease caused by the newly identified coronavirus that has been detected throughout the world. Community spread of COVID-19 has been identified throughout Texas. It's actually been found on 6 of the 7 continents in the world so far. Antarctica is looking pretty nice right about now. Symptoms tend to show up in people within 2 to 14 days of exposure to the virus. The main symptoms coronavirus patients in China experienced included fever. 89% of them experienced fever, so that's a very big symptom. 68% of them experienced a dry cough. 33% of them experienced phlegm production, and 19% of them experienced shortness of breath. Other symptoms that are possible include fatigue, sore throat, headache, joint and muscle ache, chills, and a runny nose. It's important to note that a large number of people do not have any symptoms at all, but they are still carriers of this virus. Majority of these cases will clear up with only mild symptoms, usually within 7 days. But a number of cases will become moderate, severe, or critical, and those clients can potentially develop pneumonia, which can range from non-life-threatening to severe. These are the symptoms of a severe case of COVID-19. If you have any clients or staff that are experiencing any of these severe symptoms, you should call 911 immediately, full stop. These symptoms are extremely difficult breathing, bluish lips or face, persistent pain or pressure in the chest, severe persistent dizziness or lightheadedness, new confusion, new seizures, or seizures that won't stop. Again, if anyone experiences any of these symptoms, it is time to call 911. For some severe and critical cases, symptoms can escalate into acute respiratory distress syndrome, or ARDS, and this is what happens when fluid builds up in the lungs. ARDS is often fatal. 30 to 40% of these cases are fatal, and this is how most COVID-19 deaths are caused. Even if patients with ARDS do survive, they could be left with permanent lung damage. So this is definitely something we want to avoid. So COVID-19 is a virus. It can only make more of itself by entering a living cell. According to the CDC, it's thought that the main way it's spread is person to person, who are in close contact with one another, so within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. The droplets of contagious mucus or saliva from the infected person can enter our mouths, nose, or eyes and infect us. Interesting fact, sneeze clouds can travel from 5 to 200 times faster than they would have if the droplets were simply just a disconnected group. So sneezes are very powerful at spreading this virus. Also, there have been a few instances of COVID-19 found in fecal matter of infected individuals. It also may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or their eyes. But this is not thought to be the main way that the virus spreads. We're currently unsure how long the virus can survive on non-living objects. But once it enters our bodies, it ends up in our lungs, and in short, the virus convinces your healthy lung cells to destroy themselves, and in doing so, it puts our immune system into overdrive. Some facts about COVID-19: there are many more critical cases than the flu. It's much more dangerous than the flu. It's much more contagious and spreads faster than the flu. There is currently no cure or vaccine for COVID-19. So the best way to avoid getting sick from coronavirus is to avoid being exposed to it. Really quick, I wanted to go over the concept of flattening the curve, which I'm sure most of you are familiar with at this point. So there's two futures of the coronavirus outbreak. There's fast, which is that red curve, and there's slow, which is that blue curve. Which one we are going to see depends on how we react in the early days of the pandemic, which is right now, March 2020. A fast pandemic will be horrible and cost many lives. A slow pandemic will not be remembered by the history books. The worst case scenario for a fast pandemic is this red part, which is caused by a very rapid rate of infection because there are no countermeasures to slow it down. This is so dangerous because if a large number of people get sick at the same time, we run the risk of hospital bed shortages, ventilator shortages, which are needed for those severe cases to survive, staff shortages, and a general shortage of supplies. People are going to die untreated, and if we do get to this point, we will have to make horrible decisions about who gets to live and who doesn't. In this scenario, the number of deaths rises significantly. However, if we are able to take countermeasures to slow the pandemic spread, which most of our communities have been doing in the last couple of weeks, we can potentially avoid our healthcare system being overloaded so they can treat those critical cases over a spread out period of time. This means all of us need to do what we can to turn this into a slow pandemic. The early phases of a pandemic, right now, is what decides which of these two fates we're going to see. So it's very important that we react correctly now in the beginning so that we can avoid that fast pandemic. Since there is no cure for corona, we have to change our behavior to act as a social vaccine. So what is a social vaccine? That means not getting infected and not infecting others. So we have to limit the transmission of COVID-19. The most important thing you can do right now is wash your hands. It may sound silly or trivial, but washing your hands is one of the best things you can do to avoid an infection. Soap is a very powerful tool against coronavirus. The virus is basically encased in a layer of fat, and soap breaks that fat apart pretty easily and it leaves it unable to infect you. So when you wash your hands, you need to wash all parts of them, under your fingernails, the backs of your hands, your wrists, between your fingers. Some of you have probably already heard this, but one good way to think about it is to pretend that you've just cut up a bunch of jalapenos and you need to put your contacts in now. So you want to really aggressively wash your hands and kill any of those potential viruses. You want to avoid close contact with people who appear sick. So the next best thing we can do is called social distancing or physical distancing, which means staying at least 6 feet away from people if possible. This means no hugs, no handshakes, and if possible, stay at home to protect those in our society who don't have the privilege of being able to stay home, like doctors, grocery store workers, and many of you are homeless service providers. Those people who are not able to stay at home are depending on the rest of us to not get sick and limit their chances of being infected. So this means limiting contact with other humans as much as we can. That also means staying home if you feel sick. Even if you work in an environment where you need to be physically there, if you feel sick, you need to stay home. This is so important. We should limit contact with high-touch surfaces such as handrails, doorknobs, etc. Cover coughs and sneezes with your elbow or a tissue. Immediately dispose of that tissue afterwards. Never sneeze or cough into your hands, and if you do, it happens, but go and wash your hands immediately before you touch anything else. If you're sick, wear a face mask. Face masks are really helpful at catching those respiratory droplets we talked about from your mouth and nose, but they're not really helpful at keeping you from getting sick. So if you don't already have COVID-19, a face mask is really not going to be effective at keeping you safe. So therefore, we should leave those masks for people and our local healthcare providers who desperately need them. And finally, clean and disinfect regularly. Again, soap and hand sanitizer are very powerful tools here. Use them often. And none of this is fun. We're all making a lot of sacrifices right now, but we have to remember to look at the big picture. Social distancing and cleaning, all of these things are really a really small price to pay. So stay at home if possible, or if you're sick, stay clean, and don't panic. So this is one website that you can check to keep track of where your community is in terms of this pandemic. I took this screenshot on Thursday, March 26th, around 11 a.m. So these numbers have probably risen by the time you're watching this. But if you go to this website, you'll see on the right, you can kind of scroll down by county and look at the specific numbers of your community. While watching the news constantly is not really good for our mental health, I do think it is important to stay aware of how your community is playing a role in all of this. To access this link or any other links that I provide throughout this training, you should scroll down and check out the description section of this video. Okay, now let's move into the guidance section of this. Most of this information comes from the CDC's Interim Guidance for homeless service providers. There is some information from HUD's guidance in here as well. This link on the bottom, it will take you straight to the CDC's guidance for homeless service providers, and it has a ton of information. It has a ton of checklists and information pamphlets, etc. So definitely take a look at this if you have the time. So the first thing you need to do, according to the CDC, is contact your local public health department. They can help you determine what to do if someone with symptoms consistent with COVID-19 is in your project. They can help you determine local isolation or quarantine plan for people experiencing homelessness. They can help you obtain sanitation supplies, masks, etc. if you need any. And they can help you stay informed about what's going on locally with COVID-19. So at the bottom here is a link to local public health departments in Texas. I've also put this link in the resources section of this course. You should also contact your local emergency operations center. So most local governments have an emergency operations center, or EOC, staffed by members of its various departments that is activated to manage the response to major threats like this. And it will help you coordinate internal and external resource support. So again, here's a link of all of the EOCs in Texas, and I've also included this link in the resources section of this course. You should also screen everyone that walks in your door or that you come in contact with. So screen clients, staff, and visitors, volunteers, everyone for COVID-19 symptoms upon entry to your project. Disposable masks should be reserved for clients who exhibit those symptoms. So remember that they're really only helpful at keeping COVID-19 in. They're not necessarily good at keeping it out. Hopefully this HMIS assessment we've made can help you coordinate the screening of everyone. We're going to walk through that in a little bit. And also, when you contact your local public health department and obtain any supplies that you need, see if they have an infrared thermometer, which is a way that you can take people's temperature without having to put it in their mouth. If you do decide to use an oral thermometer, you have to clean it so well. You must wash it super well before sharing it with another client. Obviously, sticking something in one person's mouth and another person's mouth during a pandemic, there's a super high risk of infection from sharing. They do make thermometer sleeves, little plastic sleeves that you can use. I would highly suggest washing the thermometer in between sleeve use as well. Just be really, really careful with that. The next thing you should do is educate everyone. Educate people as they enter your facility on symptoms, transmission, and agency policy regarding hygiene and cleaning. You should post signs at entrances and in strategic places with instructions on hygiene. Encouraging ill staff and volunteers to stay home or send them home if they develop symptoms while at the facility. This is so important to prevent an outbreak at your facility. If you have a large population of people with limited English proficiency, so maybe a lot of Spanish speakers, make sure to provide signs and posters in other languages as well. That CDC Guidance link that we just saw earlier has a lot of the fact sheets in other languages as well, which is really helpful. Cleaning and disinfecting. So have a regular schedule for disinfecting, particularly high touch surfaces. And here at the bottom is a link for the CDC's guidance on cleaning and disinfecting. Again, this link will be in the resources section. We need to promote hygiene, so ensure that your bathrooms and other sinks are constantly stocked with soap and drying materials for hand washing. Provide alcohol-based hand sanitizers that contain at least 60% alcohol at key points within your facility, including desks, entrances, exits, and eating areas. Encourage people to wash their hands often with soap and water for at least 20 seconds. Below, I've posted a viral video about why soap is so important and also some fun hand washing songs. A lot of people are posting choruses to songs that are exactly 20 seconds long, so you can promote your clients to sing that chorus while they wash their hands. Now, let's talk about what to do if one of your clients is experiencing symptoms. Isolation is key, so we need to plan now for what you're going to do if you need to isolate clients. Figure out where people will be quarantined if they present with symptoms. Ideally, an individual room with access to their own bathrooms. If that's not possible, consider using a large, well-ventilated room and designating a separate bathroom for sick clients with COVID-19 symptoms, if possible. You should reduce cleaning frequency in bedrooms or bathrooms dedicated to a sick person to as-needed cleaning. So we want to avoid unnecessary contact with the ill person. You can also leave soap and other cleaning materials with the sick person if you want them to isolate. Obviously, just be cognizant. Don't leave some strong chemicals with a child. Be smart, but be safe. If there's no space on site available, there are recommendations. So work as a system to see if there's space at another provider to offer quarantine for your client. Or develop a temporary shelter specifically for quarantine. So let's think about which staff members will have interactions with clients with respiratory symptoms. You should use physical barriers to protect staff who are going to have interactions with ill clients. So maybe that's a curtain or a sneeze guard at the check-in desk. Staff at high risk of severe COVID-19 should not be designated as caregivers for sick clients. So who is at high risk of COVID-19? Anyone over the age of 60, anyone with pre-existing conditions like diabetes, heart or lung disease, or a weakened or compromised immune system, or anyone who's pregnant. These staff should not be designated as caregivers for sick clients. Reduce cleaning frequency to as needed. So we need to avoid unnecessary contact with ill people. Below are two really great links on best practices for isolation. So now let's talk about people that are experiencing unsheltered homelessness. The CDC has a really great guide for this as well. So this is a lot of information, but bear with me. Reaching and protecting people experiencing unsheltered homelessness during the COVID-19 outbreak will require coordination across several local sectors. To prevent negative outcomes from lack of services, community leaders should continue activities that protect people experiencing homelessness, including supporting continuity of homeless services, healthcare, behavioral health services, food pantries, and linkages to permanent housing. Plans need to be clearly communicated to all stakeholders. So, homeless outreach teams and public health outreach workers will often be the front lines of this pandemic. These workers need to be prepared to protect themselves and their clients. So we should provide health education information and help direct their clients to care as necessary. State and local health departments, homelessness service systems, housing authorities, and emergency planners need to identify where people without housing can be isolated and receive care if they are suspected to have COVID-19, or if they are awaiting COVID-19 testing results, or if they are confirmed to be positive COVID-19 cases. These plans should also include transportation protocols. Hospitals and healthcare facilities should ensure that they are involved in planning the logistics for safely discharging COVID-19 patients to a designated location if they do not require hospitalization but they lack housing. Law enforcement should be apprised of plans related to protecting people experiencing unsheltered homelessness from COVID-19 in order to best work in coordination with homelessness service systems and state and local health departments. And finally, people experiencing homelessness themselves are an important resource to help navigate their communities and keep their friends and family members safe. Consider developing an advisory board with representation from people experiencing homelessness to ensure plans are implementable in the community. Let's talk about prevention measures. So, when dealing with encampments, unless individual housing units are available, do not clear encampments during community spread of COVID-19. Clearing encampments can cause people to disperse throughout the community and break connections with service providers. This increases the potential for infectious disease spread. We should instead encourage people staying in encampments to set up their tents or sleeping quarters with at least 12 feet by 12 feet of space per individual. We should ensure that nearby restroom facilities have functional water taps, are stocked with hand hygiene materials, so soaps and drying materials, and bath tissue, and remain open to people experiencing homelessness 24 hours per day. If toilets or hand washing facilities are not available nearby, provide access to portable latrines with hand washing facilities for encampments of more than 10 people. And here's a great link at the bottom on HUD's guidance of essential services for encampments. Communications. We need to provide straightforward communications to people sleeping outside in the appropriate language. Identify people who are influential in the community who can help communicate with others. Post signs in strategic locations to provide information on hand hygiene, respiratory hygiene, and cough etiquette, and request up-to-date information for each person. So, information to share with anyone experiencing unsheltered homelessness includes the most recent information about COVID-19 spread in their area, advice to avoid crowded areas if COVID-19 is circulating in their community, social distancing recommendations, so again, that 6-foot barrier from all people, hand hygiene instructions, cough etiquette instructions, and advice not to share personal items. How to recognize the symptoms of COVID-19 and what to do if they are sick. What to do if their friends, family, or community members are sick. How to isolate themselves if they have symptoms, and updated information on where to find food, water, hygiene facilities, healthcare, behavioral health resources, if there have been local closures or changes, which I'm sure a lot of us are experiencing right now. Now let's talk about the street outreach staff. When COVID-19 is spreading in your community, you need to assign outreach staff who are at higher risk for severe illness to other duties. Advise outreach staff who will be continuing outreach activities on how to protect themselves and their clients from COVID-19 in the course of their normal duties. So instruct the staff to greet clients from a distance of 6 feet and explain that you're taking additional precautions to protect yourself and the client from COVID-19. Screen clients for symptoms consistent with COVID-19 by asking them if they have a fever, a new or worsening cough, or shortness of breath. If the client has a cough, immediately provide them with a surgical mask to wear. If urgent medical attention is necessary, use standard outreach protocols to facilitate access to health care. Continue conversations and provision of information while maintaining 6 feet of distance. Maintain good hand hygiene by washing your hands with soap and water for at least 20 seconds or using hand sanitizer with at least 60% alcohol on a regular basis. Wear gloves if you need to handle client belongings. Wash your hands or hand sanitizer before and after wearing the gloves. If at any point you do not feel that you are able to protect yourself or your client from the spread of COVID-19, you should discontinue the interaction and notify your supervisor. Examples include if the client declines to wear a mask or if you are unable to maintain a distance of 6 feet. Provide all clients with hygiene products when available. Street medicine and healthcare worker outreach staff should review and follow recommendations for healthcare workers. And also review stress and coping resources for yourself and your clients during this time. All right, here are a few other resources that I wanted to send your way. There's a really good printable 2-pager on how to screen clients upon entry to shelter. There's a really good 8-minute video called Coronavirus Explained and What to Do. We also have HUD's Interim Guidance for homeless service providers. And then also the final link will take you to THN's website where we have some COVID-19 guidance. Finally, if you have any needs related to COVID-19, we hope that you will communicate those to the Texas Balance of State COC. And those of us at Texas Homeless Network, Molly Lund and Sophia Cheka are coordinating the COVID-19 response at the COC lead agency. So please, if there's anything that we can do to help you, or if you have any questions or concerns, please email Molly and Sophia. Make sure to CC both of them when you send that out. Okay, well, that's everything that we have for you today. I hope that everyone is able to stay safe and healthy, and hopefully we will all see each other again very soon. Thanks.